Thank you, everyone, for joining us. We're really glad that you joined us for our motorcycle safety today. We wanted to introduce our presenters today. We have Officer Jason Smith with UPD, who will be giving us some information about motorcycle safety. And we also have Alejandro Moreno, who was recently a nurse educator for the South Jordan Emergency Department, and who is back on the floor as a clinical nurse and is an avid motorcycle enthusiast. And because we are offering contact hours for this course, we need to let you know that there are no conflicts of interest and nothing to disclose. Oh, and then we also wanted to please have everyone be aware. We're very excited about this. This is our Intimate Partner Violence and Primer Prevention Education Series that we are happy to offer to everyone in the state that wants to be a part of that. We also want to let everyone be aware of this website, crisisstandardsofcare.utah.edu, if you don't already know about it. It's an amazing resource for burn and soft tissue injury patients and how to care for those patients. You do need to go to the website here at the bottom, crisisstandardsofcare.utah.edu, and request to be able to enter into the website, and then give that just a day or two, and then you'll be able to go in and have access to all of that, to that amazing resource for burn education. We will turn the time over to our presenters.
I was saying, my name is Alejandro. I'm a nurse. Well, I was a nurse educator. I've been a trauma nurse. Worked in neurology. I worked in long-term care. Kind of a little bit of everything. And actually, speaking about motorcycle trauma, I've seen everything from the person who rolls in a big old mangled, tangled up bag from EMS, all the way down to somebody who's walking home after a 6-month stint in physical rehab, trying to learn how to walk again or eat, mashed potatoes or all that kind of stuff. So we'll talk a little bit about all those things in this. So they had Jamie sent me over a case study of some of a particular motorcycle crash. It was pretty recent, I think, within the last 6 months. Talking about, so this, and unfortunately, this wasn't even the motorcycle rider. This is the motorcycle passenger. It was a 20-year-old female on a dirt bike in the street. So probably an enduro or some other type of motorcycle. So she was on the back. An individual was riding in the front. It is believed that they were both helmeted, but we don't know really how much other protective gear they were wearing at the time based on their the abrasions or like the scrapes and scratches and skin issues. It seems like they were wearing at least some protective clothing, but exactly what, nobody could really figure out or nobody could really identify or remember from the time. Basically, they were T-boned by a truck at about 25 miles per hour. The patient was thrown from the bike and thrown an unknown distance away from it. She was likely wearing a helmet as she had no appreciable neuro symptoms or head damage, but as we're going to go over in the few slides, she is going to have a whole lot of other stuff going on. So this is a quick rundown or a show of what kind of like it would have looked like. I don't know much about the specifics of how this accident occurred, in that, was it the truck that was running the light? Was it the motorcycle that was running the light? Was there some sort of confusion in the lights between how everything happened? But basically, we know that the patient, once they were hit this way, were thrown about 20 feet. She sustained a significant liver injury, a significant kidney injury, left hip and low back fractures, so breaks in the bone, shoulder fracture, a right leg fracture, multiple rib fractures, and then a lot of internal bleeding. So she came in originally as a trauma 2. Once they kind of got eyes on her and saw what was really going on, they increased her to a trauma 1, which kind of is the all hands on deck, and provided her all of the life-saving treatments. From what I was told, she has been recovering, was discharged to a rehab facility, and is getting back to life as normal, we hope. I mean, with 21 years old, we hope that she's kind of got time and youth and energy and stuff on her side. But when it comes to these injuries, and so here's some examples of what happened, so you can kind of see in these in the circle areas that I had drawn over here. On the left side of your screen, you can see that tibial fibular fracture and how they repaired it with those pins, rods, and nails. You can see the pelvic fracture in the 3D the 3D CT scan of where that's been broken. The real crummy part for her was that she had a right hip and a left leg fracture. So there really isn't even a way in the rehab sense for her to be able to, like hobble around or alter her gait to kind of like get by. I mean, she would be pretty much bedbound, wheelchair bound until a lot of that started healing. So the initial concerns, obviously, when it comes to any kind of trauma, especially a blunt trauma, is going to be bleeding, bleeding, and then more bleeding. And it's not always the bleeding that we can see. A lot of times, especially for these blunt injuries, it's the bleeding that we can't see. You know, hence the meme down at the bottom where, you know, everybody wants to look at like, dude, check out that leg. Oh my gosh. Or like when it's all mangled up or it's turned up backwards, or, you know, the ankles are, you know, in ways that they shouldn't be, or somebody's got road rash all over them. You know, you get these, we call them the distracting injuries, because basically that you're looking at it and you are saying, oh, this is a whole lot of mess, and you kind of get fixated on that. But in reality, that's not going to kill them. Road rash isn't necessarily going to kill you today. You know, a busted up leg isn't necessarily going to kill you today. What really is going to be the concern is those internal bleedings. We talked a couple slides ago about that liver and that kidney laceration. You know, you don't think much about your liver or your kidney, but those are highly vascularized internal organs. So they've got a lot of blood vessels that are going to them so that they can do a bunch of stuff in your internal body functions, and then a lot of blood vessels that go out of them, and rather large ones too. So you get a large volume of blood that's constantly being filtered through these kidneys and liver. The concern is when you rupture them, you tear them, you break them, you cut them up, is that you start severing all those vessels. You start creating an opportunity for now all this blood to leak out, and you're not going to see it necessarily. It's not going to be like a torn blood vessel in an arm after it got ripped off, or it's spraying blood everywhere. It's going to be inside. It's going to take a minute for it to really show some sort of difference. So in this, obviously we want to stabilize and ship as soon as possible. If this is the kind of patient that would roll into my standalone emergency department at South Jordan, we would, you know, we'd look, we'd assess, and we'd get them the HE double hockey sticks out of there as quickly as we can, because we know at South Jordan is a different situation than the main. And even at the main emergency department, we would see this and say, all right, there's a whole lot of stuff that needs to happen, but it doesn't need to happen here. It needs to happen upstairs. So we're going to get you into the operating room. We're going to get you on the surgical ICU. We're going to start a lot of things. We're going to get you going to the place you really need to be. Kind of a little bit of a difference in the idea of different types of motorcycle accidents. So the shear versus compression or blunt trauma. So there's the acceleration or deceleration forces applied to your body. This is kind of a difference between street versus dirt, which is kind of interesting that this person got in a street accident on a dirt bike. Generally speaking, and I'll show you in the next, actually I'll skip to the next slide. You can kind of see over here on the right-hand side, you're going to see a lot of more protective gear when it comes for your dirt bike riding. So these are all based on the idea that you're not going to be going as fast, and your injury is going to be more of a blunt injury. You're going to fall and land on top of your bike, on top of your handlebars, onto a rock, against a tree, something that's going to be stationary, because you're out in the middle of nowhere in the sand dunes, or up in, you know, trail riding up in the Uintas or something. You'll notice that a lot of the motorcycle gear for dirt riding is going to be much more rigid, but then also a lot less forgiving when it comes to abrasion resistance. So you'll notice they usually have a big giant chest protector, or, you know, shoulder protectors that are hard, like hard plastics that give you more crush resistance. But then if you look at the jerseys and the pants, they're generally a material that's more forgiving and vented, and allows you, you know, a lot more air movement, because they're not anticipating you're going to be going 80 miles an hour in them. Your boots are going to be really rigid. Your chest protector, all your other stuff is going to be much more rigid and not as forgiving to a slide. As opposed to, if you look on the opposite side, this is more of your streetwear, where you've got things like cowhide or other types of textiles. They have Kevlar and other types of derivatives that help with abrasion and heat resistance when it comes to sliding, because the anticipation on a street ride is that not necessarily you're going to hit something hard, which obviously you do sometimes, but rather that you're going to go down at that presumed 40 to 80 miles an hour. And a lot of them have built-in armor and built-in things that are impact resistant, but then dissipate that energy and allow you to slide off the rest of your accident. We'll go back real quick. So it's that crush versus pull, right? Are you smashing against something, and then now your body is basically dealing with that compacting of all of your body pieces against the immovable object, right? Every reaction has an equal but opposite reaction. So as you're hitting against that wall or that truck or whatever, that truck is then pushing back to you in an equal but opposite force. Now, obviously you have a whole lot less mass than that truck, so you're going to go flying, whereas that truck's just going to be, and you're going to put the little dent in it. And then how is that energy dispersed? So like we talked about that protection when it comes to dirt versus street. Like for instance, with the gear that I wear, I have my jackets, both the two different jackets that I wear have abrasion resistance in that if I slide, they will slowly tear apart, but they also have impact resistance in that they have special molecular armor that goes inside that is super duper soft, that's really pliable and movable while it's just being worn. But as soon as it gets impacted, it becomes instantly hard to protect me for that initial impact, and then goes right back to being soft as I slide out. And the same with the jeans that I wear. They have a layer underneath them that's like a Kevlar derivative that is both heat and abrasion resistant. So they look like jeans, and they have the same kind of armor in their knee and hips. But as soon as I hit the ground, those things they become extremely rigid to protect me from that initial blunt force, and then disperse that energy out. The jeans on those jeans will just disappear. Like as soon as I'm sliding down at 75 miles an hour down the 15, they will just tear apart into oblivion. But underneath them is that layer of that Kevlar lining that's going to keep from getting too hot and keep from scratching me up from having the pavement. I mean, it's probably still going to really hurt, but I'm hoping never to get there. So yeah, so is that energy dispersing of that stop versus slide kind of mentality of how you're going to build up your gear and why you would wear what and in what scenario. My racing jacket won't necessarily do me as well out on the trail ride, whereas my trail or my motocross type gear won't do me as well riding the 15 just to get up to work. So yeah, we always say dress for the slide, not for the ride. It's from a safety aspect, and I don't want to get too much into the officer's safety presentation, but I mean, I am a huge proponent of wearing gear. There's actually, I think I didn't put it in this one. There's an acronym. It's called ATGAT, all the gear, all the time. I'm a huge proponent of all the gear. It doesn't matter if I'm going down to the Costco to fill up my tank, or if I'm going all the way downtown, or if I'm going on a leisure ride. I wear a full face helmet, gloves with knuckle protection that are gauntlet style, so they go all the way past my wrist, full leather or other type of abrasion resistant jacket with armor. I wear jeans that have the Kevlar lining and armor. I wear boots that are specifically designed for that. And I do that every single time, regardless of whether it's 100 degrees out or 10 degrees out. I don't ride in 10 degrees anymore. That's the college years. I have a car now. But you always want to dress appropriately for the activity that you're doing. It's super cool to look like this dude at the bottom over here with his friend. And it's fun until it's not, and that's what ends up happening is that you get what should have been, because looking at the guy right above it, I'm sure it's not probably the same guy, but it might be. That easily could have been prevented. I mean, that could have been a couple bumps and bruises and he would have gotten up and been fine. And instead that is, months and months of rehab and additional visits to wound care and potentially the burn clinic, and keeping that from getting infected. And it becomes a whole nother thing on top of scarring issues. And then that personal self-image issues and that sort of thing. You want to just be careful when it comes to this, because there is obviously there is an inherent risk with riding a motorcycle. To say otherwise is just being foolish at best and just being totally oblivious at worst. You have to realize that there is an inherent risk in getting on one of these death traps and these death machines. And I understand that. And I mitigate my risk as best I can. And in the safety portion, I'm sure we'll talk a little bit more about, driver safety, being aware, hyper vigilant, and then also as an automobile driver, being vigilant for those who are on the motorcycles, to be aware of their surroundings, to be aware of who's around you at all times. When it comes to these traumas, little things can cause a lot of damage. I mean, you saw that young lady with, I just showed you a couple of the real big scary things, plus the other things you couldn't see. I mean, that was from a 25-mile-an-hour collision. I mean, most of us, if we got in a 25-mile-an-hour collision, you get out and kind of swear at the other person, exchange your insurance information, you go about your day. No big deal. This other lady had her life totally turned upside down. So that's why it's really important, if you decide to be a motorcycle enthusiast, take part in these sort of things, to take it upon yourself to mitigate that risk, to outfit yourself appropriately, to protect yourself appropriately, and to be vigilant at all times when riding and also when being in your car. Yeah, so like I said, kind of summarizing everything, I mean, when it comes to the motorcycle wrecks, I mean, they're either really, really disastrous because somebody's lost an arm, or, their motorcycle is fallen out. Like there's a lot of things that can go really wrong. And it's kind of interesting because I've seen motorcycle wrecks with gentlemen that look like this guy right here, and they were perfectly fine. They were just kind of more worse, they just looked worse than they were. And I've had other people that came in that looked perfectly fine otherwise, but we're suffering from all those internal injuries. And those are really the dangerous ones to think about, especially if you come across any kind of a motorcycle accident. If you're out in the community, if you're driving down the road and you come upon an accident, you want to help, there's going to be a lot of things that you're going to want to take into consideration. One thing I should also mention is please, under no circumstances ever should you ever remove somebody's helmet when you come a chronic crash. Leave that for EMS, leave that for the docs and the nurses who take them to the emergency department. A lot of times if they're still stabilizing their head and you're sitting there, if any of you have ever put on a motorcycle helmet and a properly fitted motorcycle helmet, you got to kind of wiggle that thing out. My helmet actually has special removable cheek pads on the inside that say EMS only. And so if I'm wearing my helmet, which is well fitted to my face, EMS can come and pull these two cheek pads out, which increases the ability, like it takes like this much padding out of each side of my helmet to then be able to just slowly lift it off while holding C-spine precautions. You want to worry because they've been through this traumatic event. You don't want to move them around to potentially make their neck injuries worse or cause them a neck injury, heaven forbid, because they might be loosey-goosey and you're trying to wiggle this helmet off of them and you could potentially cause an injury where there wasn't one before. Same goes with their back, same goes with other things. If you recognize that they're having, going back to stop the bleed, if you're realizing that you're having some sort of life-threatening bleeding issue, then yeah, address that, obviously, because they can live with a broken neck, but they can't live with no blood. But if you don't appreciate anything like that, especially if you come on scene and see this, the best thing you're going to do is keep them down, keep them calm, remind them not to move, and just get EMS there as quickly as possible.
Hey, Alejandro, we do have a question.
Yes.
Where do people purchase this protective gear?
So there's all kinds of different places. Obviously, there's like KSL and Facebook Marketplace. I say that, take that with a grain of salt because you don't know where this gear's been. You don't know what's happened to it. And my biggest thing is like, please don't ever buy a used helmet. Like just buy it new. Buy a new helmet every single time. They're not that expensive. And also don't buy a super cheap helmet. You know, like the first time I bought a helmet was $300 and I was like, you gotta be kidding me. And I saw other ones that were $49.99. I was like, I should just get that one. But at the end of the day, when you're falling off that motorcycle and your face is hitting the ground at 80 miles an hour, are you gonna be thinking like, man, I should have spent that extra money? Like it's worthwhile. If you take good care of it, they should last you about 5 years, which is excellent because I mean, I spent $350 on my last helmet, had a bunch of cool tech on it, got 5 full years out of it. And it felt great. And I felt, I was sad to retire it, but then I went off and got another one. And there's all different kinds. There's half helmets, which I say don't. 3/4 helmets, which are better, but I still say don't. I'm a huge proponent of the full face because this is my money maker. You got to protect the goods.
It's the mustache.
That's all we got now. Right? COVID took the
And beard. I know Jason is like shaking his head, like totally agreeing with you. It sounds like he's going to have some information for that as well.
I mean, more is always better. And they have modular helmets. So they have them where they like pop up the whole front face, which is less secure than a full face. But either way, full face is always the best, in my humble opinion. I mean, even when I rode a scooter back in college, I'd still wear a full face helmet because at the end of the day, I mean, you want to keep your teeth. You want, I don't know. It's all personal choice, but there are plenty of websites, not to promote anyone in particular, but there's one website in particular. It's called Revzilla, REVZILLA.com. The main reason why I love them, obviously they have great deals, great prices, tons of gear and everything from street to adventure touring to dirt to everything. The thing I love the most about them is 2 big things. Is that one, they have a YouTube channel that does gear review on almost every single piece they do. And second is they have a live chat, and it depends on the hours, especially now with COVID. But they have a live chat function where they have specialists that work with all this gear and everything. You can ask any question, and I've done tons of research with them, just asking them questions. They'll provide you links. They'll provide you, suggestions depending on what your price points are, depending on what your riding style and how you're riding. Are you on a cruiser versus a sport bike? Are you on an off-road bike or an adventure touring? And they can kind of really help guide you in something that would be more worthwhile. Free shipping. They don't pay me to say that, but I bought from them before and they have been awesome for me. So it's a great place to start. If you have no idea, it's an excellent place to start getting that understanding of what gear is important, what should I be spending my money on, and what can I just kind of leave by the wayside.
Also, is there a helmet law in Utah? And maybe
I'll quickly answer that question for you. There is a helmet law. Anybody under the age of 18 is required to wear a helmet. And you can issue citations, make traffic stops based on that. So, but other than that, 18 and older, you're dumb if you don't.
Just wear a helmet, man. Just wear a helmet.
So we did have a great comment from them who says, if you go to the helmet store and tell them you're an emergency responder or a nurse and ask for lessons, a lot of them will be able to educate you on options for removal of the helmets, which was quite enlightening for her, which is a good comment, I thought.
Perfect. Yeah, absolutely.
No, I was just saying, Brittany just said that she's seen a little kid wearing a bicycle helmet on the back of a motorcycle, and that's just not gonna.
Yeah, don't do that.
It's not good. Helmets are certified. either a DOT or a Snell. Snell is a higher rating than DOT. You know, every 5 years you should cycle out your helmet, depending on how much you sweat when you're riding and stuff like that. That does break down Kevlar. So
yeah, that's really the end. I mean, it's crummy because it's an investment right now, and it's an investment in yourself. And you'll want to try to take that cheap way sometimes, but at the end of the day, it's like, this is what's really going to protect you and save your bacon later on. And you want to be able to invest in good stuff there. Like, this is an example right here. So like my helmet's DOT and Snell certified and then on the bottom, this is what it looks like. You can see these emergency cheek pad removals. So for EMS, they can come in and pull on this. I don't want to pull it out because you're not supposed to, but this whole entire section over here will pop completely out on both sides. And then this whole helmet will have like this much room on both sides of my face to then just slip right off.
Fantastic. I think we're going to turn the time over to Jason just so we can get through his whole presentation as well. And then we'll take some more questions at the end. So Jason, it's all you.
Sweet. All right, I am Officer Jason Smith with the Unified Police. I've been law enforcement officer for 20 years. I've been a motorcycle operator, officer, instructor for the last 15 years. So I've ridden quite a few miles on my motorcycle. And like Alejandro said, he said an amazing amount of stuff. Quality equipment, it's necessity. And you see people every day riding around with their shorts and t-shirts, and I mean, it just, kind of ridiculous to see these people. I call them the Sunday driver. They're just out there cruising, not caring about anybody in the world other than themselves, not paying attention to traffic, just driving. And those are actually the most dangerous motorcycle riders there are. People who are just not paying attention and just not caring for themselves. Because head injuries are really the worst injuries that you can suffer from motorcycle crashes, and unfortunately I lost my brother in a dirt bike accident due to a head injury and stuff. If he was wearing a motorcycle helmet, he'd still be here today, but he decided to go riding without it and lost his life because he had a traumatic head injury and passed away in life flight. So, every time you jump on a motorcycle, you're taking your own life in your own hands and stuff like that. So, I think, to be honest, the best advice that I can give people is motorcycle safety courses. Continue education. Cars want to say that they see you. The best way to prevent accidents is allowing cars to see you, not being that person that's hiding in blind spots of vehicles. Traveling just a little bit faster than cars, not way faster and blasting past them where they're surprised that you're there. Just travel so that they can see you, and be mindful of blind spots on everybody. And that's where a lot of the accidents come into play, is the motorcycle operator is just not paying attention, staying in their blind spots, get cut off, and being very cautious through intersections. Intersections are probably the most deadly areas that you can travel in with a motorcycle. Keeping your head on a swivel, constantly checking the intersections, slowing down for the intersections. Huge thing. So, but I think continue education. And if one thing that a motorcycle operator can learn is proper braking. Proper braking is probably the single most important thing that you could ever learn while riding a motorcycle. I did a lot of testing for Northwestern University and stuff. We had a Harley Davidson, 2009 Harley Davidson. We set it up with some downriggers on it, and we did a lot of braking, a lot of brake testing and stuff like that. Disabled ABS to test how far I could actually ride out a front wheel lockup. Front wheel lockup is probably the most dangerous thing on a motorcycle that out of anything riding. And that usually occurs because people don't practice proper braking. And so they get into their panic braking and they just grab a whole handful of brakes and just lock up the wheels. So at 55 miles an hour, the longest skid I could get out of a front wheel lockup was 16 feet. And 16 feet is not very far when you're thinking you're traveling 55 miles an hour. So at 55 miles an hour, you're traveling about 75 to 80 feet per second. So if you think about a 16-foot skid and you're traveling 80 feet per second, how much time do you actually have to realize you have a front end lockup? It's basically milliseconds. We try to teach, realizing and understanding and seeing what a front end lockup is. To be honest, I don't think those techniques work because you don't have enough time to react to a front end lockup. That's why I think teaching an individual how to properly brake is so much more important than realizing that you're in a lockup. And there's a lot of different advanced courses that go in very, very detail about braking, and it is save your life. Rear wheel lockups are no problem. I rode a 168-foot rear wheel lockup from start to finish, put my feet down, no big deal. It's the front end lockup is the most deadly. So I would say for, advice for people, check out all of the MSF courses that are out there, and there's tons of them in Utah. And that's the Motorcycle Safety Foundation. They certify these classes and stuff like that and say this is a great class, all the way from beginners learning how to get your motorcycle license, intermediate to advanced, and then if you want to, you can go out to, I'm not sure what it's called anymore, Larry Miller Raceway is what it used to be called. They do even more advanced, like beyond like professional type trainings and stuff like that, to improve your skills. And the huge thing is about motorcycles is never stop learning. Never stop learning about your motorcycle. Pay attention to everything, brakes, tire wear, stuff like that. Know what it takes to do threshold braking, whatnot. Know if your bike even has ABS. Know what it feels like when you get in an ABS event, because braking is huge. That will save your life. You get into that intersection and car pulls out in front of you. If you do proper braking, you might be able to get stopped or at least slowed way down to a decent speed before you hit the car. I mean, if you can reduce your speed 25 miles an hour from 40 miles an hour hitting a car, your kinetic energy is going to be substantially less. So you're going to have a lot less damage to your body and stuff like that. So super, super important. Braking is key.
Everyone, we did put the Motorcycle Safety Foundation link on the chat side. So it's www.msf.usa.org if you want to look at that. And then the other question was, is driving between lanes legal between cars when we see motorcyclists do that?
Yeah, so I'll go into lane filtering right now. So lane filtering, they kind of started that because they were thinking that motorcycles coming up the intersections, people not paying attention and stuff like that, they would rear end motorcycles frequently. And so what they wanted to do was to try to get that motorcycle out of that lane to protect the operators and the passengers of the motorcycle so they don't get rear-ended. To be honest, I really dislike this law, and that's my personal opinion. I have seen more, not necessarily bad injuries, but I've seen more property damage than I did seeing motorcycles get rear-ended. That's the thing, is I very rarely ever saw motorcycles get rear-ended. And I've already seen a ton of vehicle damage from motorcycle operators trying to cut in between cars, and the cars are a little bit too close, taking off mirrors, hitting the handlebars on the mirrors and crashing in between the cars, and then pinning themselves in their motorcycles because they're jammed in between these cars. So let me explain what lane filtering is. So lane filtering is a way for a motorcycle operator to clear vehicles and to get in front of them so they're not rear-ended. The street cannot exceed the speed limit of 45 miles an hour. And a lot of people are not knowing the law. And so people are lane filtering on Bangor Highway. Not okay, because there's no speed limits on Bangor Highway that are below 45 miles an hour. So that creates a problem right there. So also you have to basically you come to a stop once the vehicles are stopped, and you can travel in between those vehicles up to 15 miles an hour. If the light cycles while you're traveling through those vehicles, you need to actually stop. Cars need to pay attention, so this is kind of important for vehicles too. Vehicles should allow a motorcyclist to get in front of them and to proceed and go from there. If you do end up making it up to the front, move over to the side a little bit, try to get in front. The best thing I suggest is try to make eye contact with the driver of the vehicle, so they're aware that you're there. If you pull up in front of them and they don't know you're there, and then they start going forward and they strike you, I mean, to be honest, I actually think it's kind of the motorcycle's fault. Technically it's not. It would be the vehicle's operator's fault. But then now we have injuries and all sorts of
motorists. That's something you can do if you happen to see a motorcyclist around. Be their protector, be their guardian angel, and provide them the space. Give them the distance they need to be able to brake appropriately. Don't cut them off if they're going to make a left-hand turn. Be cognizant and aware of your motorcycle friends out there, because it might be me, it might be somebody, it might be Officer Smith, it might be anybody.
So it is legal up to 45 miles per hour.
Yeah, so the street
Yes.
you're on can only be up to 45 miles.
Yeah, but that's okay. One of the things that somebody had talked about is how can they as a driver be more aware of motorcycles on the road?
Just kind of keeping your head on a swivel and just get rid of the distractions. And that's the biggest thing, is all the distractions that we have nowadays as a vehicle operator. I mean, we have radios and our cell phones, and I mean, I have a computer in my car and all sorts of nonsense going on. And just being aware, paying attention. Yourself also, when you're going through intersections, pay attention and try to, when I'm traveling through an intersection and stuff, I try to make eye contact with the motorcycle operator if he's making a left-hand turn. If I don't make eye contact with him, he might not even see me. So the best thing is try to make eye contact with the individuals. There'll be a lot of times, and on the other hand, when I'm on my motorcycle and I'm traveling through an intersection and I see a guy looking at me in a vehicle that, is making a left-hand turn, and he's kind of looking, I'll look at him and I'll kind of point at him and get his attention. And then he's like, whoa, I see you now. So, and that's the biggest thing, is just, you got to be careful. Motorcycle operators have to be extremely careful. Cars, people, they don't see you. And that'll be 90% of the things when I'm on a crash doing an investigation, where the operator of the vehicle says, I never even saw them. And that's the hardest thing, is just making yourself aware. And it's kind of, you have to be very cognizant as a motorcycle operator of your entire surroundings, in front of you, behind you. Don't be that guy at the intersection who clicks your transmission into neutral and takes your hands off of your handlebars. What are you going to do if you have to make an evasive maneuver real fast? You're not doing anything. You're going to be jumping off, or you're going to be getting slammed in. So, I mean, riding a motorcycle is no joke anymore. It's huge right there. There are a handful of motorcycle operators out there that are just completely reckless. And I like to talk to those guys. I like to make traffic stops on them and have a serious chit chat. And those handful really give a bad reputation to the rest of the motorcycle community, because everybody's like, all motorcycle, and it's just like everything. All motorcycle operators are reckless. They just drive like they're crazy and don't care about anybody else other than themselves. And that's just based off of a handful. So I like to remind operators who are a little out of control that you need to give drivers an opportunity to be able to see you. You just can't fly around them like a madman. And once they're doing those type of things, they give the motorcycle community a bad rap. And it's generalized, and it's just like anything. And just like certain sports cars, everybody says those are awful sports cars because there's a handful of those guys who drive them completely reckless. So absolutely.
I also just bring something. Teresa Brent said that her boys took a beginner and advanced motorcycle riding course in Salt Lake Community College. So that's another resource in addition to the Motorcycle Foundation. Just wanted everyone to know that was commented.
No, absolutely. Just any education you can get is good education, and it doesn't matter if it's through Motorcycle Foundation or any other certified company and stuff like that. Any education is good education. And like I said, if you can learn only one thing, learn how to stop that motorcycle. That is the biggest thing that you can ever teach yourself.
She agrees that helmets should be worn while riding, but the one thing she hears the most is it affects my visibility and makes them more likely to get in an accident. So if either one or both of you want to respond to that of people's, I'm not going to say excuse, but thoughts that wearing the helmet makes their visibility go down.
So I've heard that before, and I think the biggest thing is it's a piece of equipment that if you're not used to wearing, it's like a mask. It's like, why do people right now a face covering in the world we live in? People complain about a face mask, but almost everyone that I see on this Zoom call has worn a face mask for hours and hours and hours on end because we've been trained on how to use them, and we're used to using them. We know the value of using them, and we know when to appropriately use them. So when you bring a layperson in and be like, wear this mask every single day, every single time you're walking out, that becomes more of a difficult for them. And it becomes like a hindrance for them to want to wear because it's uncomfortable. They don't understand the reasoning and that sort of thing. When it comes to the helmeting, a lot of it, I think, has to do with fit and finish. It's the style of helmet they're wearing. Is it properly fitted for their head? Is it too big? Is it too small? Yeah, if I wore a helmet that was 2 sizes too big and every single time I turn, it would slosh back and forth, which I've done in the past. Yeah, I would not want to wear it. And I'd say it affects my visibility. Same with if it was so small that it squished my face up and I couldn't see. I totally understand. Getting the appropriate size equipment, I think, is really important. And it just takes that effort on you to understand what's the purpose behind why I'm doing this. Yeah, it restricts my free movement and I don't get to feel the wind on my face the same way. But at the end of the day, I'm trying to get home, with as minimal injury as I possibly can.
I agree 100%. And it truly is. And it does take a little bit to get used to your equipment and stuff like that. But like Alejandro said, fit and finish. It's if you purchase a helmet that fits you properly, it may reduce your peripheral vision just a tiny bit. But that's like I said, keep your head on a swivel and constantly be looking around, especially going through intersections. You get used to it, just like you get used to your equipment. And then it's just another thing that is just how you always work. So
I see Sharon has a question about stats on C-spine injury versus head injury with or without a helmet. I think a lot of that just depends on the individual. Like I've seen people without a helmet come out fine and people with a helmet come out bad. It all really depends. Honestly, it's the nature of your individual crash, the forces that are applied and the way you apply. So if I low side my bike where the bottom of it comes out and I slide flat against the ground, my chances of being fine are much greater than if I high side it where it actually tosses me over the top of the bike, where I could be flying out. And then depending on how I land against the pavement, if I'm hitting something, a lot of that just kind of is dependent on the injury and what's going on. We get a lot of the high sides that happen or low sides on the canyons. The hairpin turn up on, I think it's Big Cottonwood, that AirMed told me they have pre-programmed in their GPS because that's what they're always responding to. And that was the first accident I got the day after I purchased my first motorcycle this year, or 5 years ago, 6 years ago, whenever it was that I bought my first motorcycle in my adult life. And it was a gentleman, who had but he was wearing all the gear and was really, really messed up. Like he just hit a tree the wrong way, broke his back, had all these other problems. So a lot of it just depends on the style of riding you're doing, what you're doing, Officer Smith's brother, who unfortunately passed away, was probably not going that fast. He probably wasn't doing anything that he was outside of his comfort zone. He just hit his accident in the absolute wrong way that caused him the most amount of damage. So like we were talking about before, it's understanding the way you ride your bike and then also taking into account those unforeseen factors, things you're not going to be able to control. Is it going to be what do you call it? Is it going to be gravel on the road? Is it going to be an inattentive driver who turns into your lane? Is it going to be, you know, a bug that flies up and obscures your vision? You know, what's it going to be? You have to sort of try to take all of that into consideration when you're riding, and have a contingency plan for what you can try to do if that happens.
So I just pulled up some CDC statistics. Helmets saved an estimated 1,859 lives in 2016. If all motorcyclists would have worn helmets, they estimated that 802 additional lives would have been saved. And helmets reduce the risk of death by 37% and reduce the risk of head injury by almost 70%.
Yeah, so that's huge. Those are huge numbers that show like you know, that's a big reason as to why you would want to do. And I'll tell you that it's as much a cultural thing, though. The way you see people getting upset about masks, sorry to bring it back to the topical thing. Like when I was in long-term care, I had a dude who was at Sturgis, the giant like motorcycle rally out in North Dakota. And he came in and we were rehabbing him for his head injury after a motorcycle. And I asked him, I was like, are you ever going to ride a motorcycle again? He's like, well, I want to one day. And my next question was, will you wear a helmet this time? I couldn't even finish the question when his answer was no. I was like, what, dude, you're getting rehab for a brain injury. He's like, I don't care. I don't ride with a helmet. That's just me. And I'm like, Steve, I'm sorry, man. Like, I can't help you, but you should wear a helmet. No, it's the way I live my life. I'm like, oh, okay, man. Whatever. I don't know. It's a way to live a life, but also it's not the way I live my life. So that's
Yeah, that's not me. I would never. I hate that so bad.
Yeah.
My daughter, I just bought her a dirt bike. And to be honest, I actually forgot how expensive helmets were. Because I haven't had to buy them. I've had office issued ones that we've gotten. Her helmet was $175 for a 5-year-old. And I'm like, what? And then you think about it. Right. If it saves her life one time, $175 isn't.
For Alejandro or Jason, or if Alejandro or Jason, you guys have any more comments while people are filling out the poll, we'd love to hear more from you.
I'd say keep safe. Honestly, I'm a huge proponent for the education factor, like we were talking about earlier, the safety course. Even if you're not ready to start riding, like if you don't have a motorcycle, the cool thing about the beginner courses is they provide you a motorcycle to learn on. It's a great way. It's a smaller 250cc engine, small like cruiser style bike. They're really, really simple to learn on. They take a lot of effort to make sure you feel comfortable on them. And it also takes care of your driver's test for the DMV. All you have to do is after you do that, you go in and just take your written test. And then you'll have the certification, the endorsement. You can then at that point, whenever you feel like you can get a motorcycle or not or whatever. But it's really awesome, and it's a great opportunity to get those basics in. And then practice. I mean, even doing things like go find a large, church parking lot or, Walmart parking lot or something, and just ride around and practice. Like you said, feel your bike, feel what it's like to have to stop, using the different types of brakes, feeling what it's like to turn around, give it a little bit of gas, slow it down a little bit, but get a feeling for what your bike can do.
Thank you, both of you. Great.
Yes, thank you for joining us. I like to throw out there, we have an extra Trauma Grind Rounds on Thursday morning for you healthcare providers that are part of that. Come and join us for Trauma Grind Rounds on Thursday, and then we'll hopefully see you in 2 weeks for the falls presentation for fall safety.
Sweet.